think of two things: static stretching and dynamic stretching. Okay, this is very important. So what is static stretching and what is dynamic stretching? So static stretching, I think, is the one that most of us do. Example, stretching the muscle. Example, just holding and stretching the tricep. You just hold it there and stretch out the muscle. So this is static stretching. You don't move. You stretch out and hold the muscle there for a few minutes to stretch out the muscle. Dynamic stretching, example. So you move. Is very dynamic. Example, if you are going running, you run on the spot for 2 to 3 minutes. That's dynamic stretching. So you don't really hold the muscle, but you reproduce the action in a slower, lower intensity. So that's dynamic stretching. So it's been shown that static stretching affects performance. Okay, so we generally advise patients to do static stretching after training, because we don't want the muscle to stretch out, because the muscle has an ideal length. The length actually affects the muscle, and the proprioception, that means the balance of the muscle, is affected by the length. So if the muscle is stretched out, they may not be able to balance so well. So you do it after to prevent muscle ache later. But you should do some dynamic stretching before. So like I said, if you're going to do a bicep curl, instead of immediately grabbing a 10 kg load and doing bicep curl, you can do it like that for 1 minute, just to reproduce the action and to stretch out the muscle. But stretch out the muscle and to warm up the muscle, not to stretch out the muscle. So this is dynamic stretching on the left and static stretching on the right. Okay, so I hope that because I think many of my patients will tell me, when I ask them whether they stretch, they will tell me all about static stretching. Stretch the quads, stretch the bicep, everything. But dynamic stretching is the one that's important before training, and it can actually, in fact, increase the performance. And there's actually a special program called the FIFA 11 Plus Injury Prevention. Okay, it's available online and it's free. It's a 20 minutes warm up. Okay, so most of us, I don't think we need to go through a 20 minutes, but it's something that is really, really useful. That's just one of the examples on the body position, when you jump, when you run. So in ladies, because of the wider pelvis, the knee tends to go inwards like an X shape, and that's not so good when they land, because the force will push the knee inwards and tear the ACL or the meniscus. So when we go through all this with the individuals, we always correct them, feedback, ask them to practice in front of a mirror or practice with a friend. So the key take-home message of prevention, I think first and foremost, address the extrinsic factors, because it's easy. So selection of the sports or exercise that suits you, that fits you. If you want to play contact sports, just be ready for higher risk of injury. I mean, I've done ACL reconstruction, ankle reconstruction, and they are mostly for football, basketball. But badminton is one of the non-contact sports that's quite high risk of ligament injury because of the twist and turn and the high impact. And I choose the same environment. So if my patient is switching from a gym to an outdoor, I'll ask them to explore the running route first. Run through the route, walk through the route, and don't change the route. I know some of us like to change just to make it more interesting. But if you're not ready, then don't change. If you're going to run at night, I always ask my patient to explore the environment in the daytime. Take note of the stat, take note of the pothole, and then you can run at night if you want to. Okay. Intrinsic factor takes longer. That's why we deal with the extrinsic factor first. So conditioning, very important. As you get stronger, as you get fitter, as your endurance and strength increases, you respond better to unpredictable circumstances like a pothole. And very importantly, gradual step up intensity, okay, and frequency. So you can either step up by increasing the intensity, maintaining the frequency, or you can maintain the intensity and increase the frequency. Okay, but I think most of us like to keep the frequency and increase the intensity because of time constraint. And stretching, very important. Dynamic stretching pre, just try it tomorrow. Okay, dynamic stretching pre and static stretching post. Okay, static stretching is still important. I think because at least for my reading and from my personal experience, static stretching does reduce the delay onset muscle soreness for me. So some people after exercise, they get this muscle soreness, not knee pain, but the muscle around the knee, they get sore. But I think the stretching helps to reduce the incidence of a muscle ache. And of course, special program for those who have resources, and for those who are really, really into exercise, you should get a special program, either see a physiotherapy or a personal trainer. Personal training is more for gym. I think that the gym is important. At least I've been telling my patient, at least just invest in the first few sessions for the personal trainer to look at your form, make sure everything is okay, and then you can do it on your own.